Clearing the way to reliable results, the importance of clarity in clinical research. Are you involved in clinical research or trials? If so, then you know how critical clarity is for achieving reliable results. From accurately defining variables to having a precise methodology and clear informed consent process, every aspect of an investigation requires a high level of clarity. Miss Rosalind Franklin, the renowned scientist, is an excellent example of the importance of clarity in scientific endeavors. In this blog, we will explore how clarity impacts clinical research/trials and why it's a fundamental aspect of any investigation. So, whether you are a medical doctor, research associate, or other clinical trial-related personnel, read on to learn why clarity is essential for achieving success in clinical research. Miss Rosalind Franklin was a scientist distinguished by her extreme clarity and perfection in everything she undertook. Her photographs are among the most beautiful X-ray photographs of any substance ever taken. This is an excellent example of how clarity is a crucial component of any scientific endeavor. In clinical research/trials, clarity is of utmost importance because trials are at the highest level of evidence in medical science. Clinical trials help to assess causality and determine whether any intervention is genuinely generating outcomes in patients and if these are occurring due to chance or not. Therefore, a precise set of rules and procedures must take place to analyze interventions and outcomes properly. Clarity is a broader concept required by every aspect of an investigation, including the accurate definition of variables, precise methodology, precise inclusion and exclusion criteria, and many others. For example, a research protocol is a set of instructions to conduct clinical trials. It specifies everything the investigators, medical doctors, research associates, and other clinical trial-related personnel must do to achieve reliable results. Just like following a recipe ensures culinary success, guiding investigation by the protocol is essential, not only for ethical and regulatory affairs but also because it allows everyone involved in the investigation to have a standardized procedure. The simpler the instructions are, the more clarity will be present in the protocol, translating to the best results in the clinical trial. One of the fundamental aspects of clinical trials is the definition of variables. They need to be defined accurately and unambiguously, including the definition of the outcome variable. This helps ensure that there is no confusion among investigators and patients regarding the purpose of the trial. Additionally, it helps standardize data collection, and the measurement of the outcome variable is reliable. Precise methodology is another essential aspect of clinical research. It ensures that the data is collected and analyzed in a systematic and standardized way, minimizing the risk of bias. If the methodology is unclear or inconsistent, the trial's validity may be compromised, resulting in unreliable results. Standardizing methodology makes it easier to compare results across different studies, increasing their value. Inclusion and exclusion criteria are equally critical in clinical research. It is essential to accurately identify and select patients who meet the criteria for the trial. This is necessary to ensure that the study population is representative of the target population and to minimize confounding factors that may affect the results. Additionally, exclusion criteria are necessary to minimize the risk of harm to patients who are not suitable candidates for the intervention. If inclusion and exclusion criteria are not clearly defined, there is a risk of enrolling patients who do not meet the trial's requirements, which can affect the validity of the results. Furthermore, clarity is vital for the informed consent process. Patients must have a clear understanding of the trial's purpose, the potential risks and benefits, and their right to withdraw from the trial at any time. Informed consent should be obtained in a way that is clear and understandable, and the patient must have the opportunity to ask questions and clarify any doubts. In conclusion, clarity is a crucial component of clinical research/trials. It is essential to accurately define variables, have a precise methodology, accurate inclusion and exclusion criteria, and a clear informed consent process. The simplicity of the protocol allows for everyone involved in the investigation to have a standardized procedure, increasing the likelihood of reliable results. When the clinical trial's purpose is clear, and the methodology is precise, it increases the study's value and the potential to improve patient outcomes. Clarity is fundamental in clinical research and must be an integral part of any investigation.